Imagine seeing a foal born, I mean, just moments old.
Yeah.
And it has this coat that's so incredibly white, it almost seems to glow, right? With these bright, sort of sky blue eyes. It's just stunning. You see this sometimes in breeds like the American paint horse, famous for their amazing color patterns.
Yeah, they're beautiful.
But here's the really cruel twist. For some of these foals, that perfect white look, well, it's not just beauty, it's like a warning sign.
A signal.
Yeah, signaling this hidden genetic problem. It takes that moment of pure joy and just flips it into profound sadness. Leads to a condition that's, well, there's just no cure.
And that condition is Lethal White Foal Syndrome, or LWFS. You
Yeah.
also hear it called Overo Lethal White Syndrome, OLWS, or sometimes ileocolonic ganglionosis.
Quite a mouthful, that last one.
It is, but whatever name you use, it's a fatal genetic disorder. It primarily affects foals that have certain white spotting patterns, especially the frame over row pattern. And a really heartbreaking part. These foals, they look completely normal when they're born. Vigorous even.
Right. They seem fine.
But then, very quickly, they start showing signs of severe gut problems, gastrointestinal dysfunction. And that leads to a really painful and, well, sadly, an inevitable death.
Okay, so we've got these incredibly detailed sources you shared about this condition. It seems kind of mysterious at first glance.
Yeah.
Our mission today really is to unpack all of that. We want to pull out the critical knowledge, look at the surprising genetics behind it all, really understand those awful clinical signs, figure out how it's diagnosed, and maybe most importantly, how this truly heartbreaking condition can actually be completely prevented.
Exactly. Prevention is key.
And it sounds like that key really lies in understanding the genetic link.
That's right. It all comes down to the genetics.
So diving into these sources, the thing that really jumped out at me first was how the initial clue, this big signpost for this tragedy, is something you see instantly. It's the foal's appearance, that striking look.
The phenotype.
Affected foals are usually born completely white, or maybe almost completely white. They've got that pink skin, those blue eyes we mentioned.
Sometimes you might see tiny spots of color. Maybe around the muzzle or underneath on the barrel or perhaps near the tail, little patches.
But it's really critical, isn't it, to know this isn't the same as other healthy white patterns?
Oh, absolutely crucial. You have to differentiate it. It's not like a healthy, dominant white horse or, say, a double dilute color like a Cremello or a Perlino. Those are perfectly healthy genetic variations.
Right. They look white, but it's a different reason.
Exactly. In the case of LWFS, this all-white appearance is, well, it's a deceptive start. Looks beautiful, but signals a major problem internally.
And that initial appearance is so deceptive. Because like you said, they might seem okay at first.
They do, often quite vigorous. They might stand up, even nurse normally for a bit.
But then things change fast.
Very fast. The critical symptoms, the really obvious ones, they usually start showing up within, say, 12 to 24 hours after birth. And the main clinical sign, the hallmark, is severe colic. Really intense abdominal pain.
What does that look like in a foal?
Well, you'll see signs like they fail to pass the meconium. That's the very first stool. They show progressive pain. So things like rolling, thrashing around, looking back at their flanks.
Real classic colic signs.
Exactly.
Yeah.
Sweating, their heart rate goes up, breathing gets rapid, and you'll notice their abdomen starts to swell, gets distended. That's from gas and, milk building up inside.
Because it can't move through.
Precisely. Despite all their efforts, the foal just cannot pass any feces. And the reason is the nerves controlling the colon, they just aren't there. They lack the proper innervation. It's also worth mentioning, some foals with LWFS might also be deaf, which points to the fact that the genetic issue affects the development of more than just the gut nerves.
Wow. Okay, so hearing about these terrible symptoms, it just makes you ask, what is fundamentally going wrong inside the foal's body? What leads to, well, the inevitable outcome?
Yeah, the root cause, the pathophysiology, is the absence of what are called enteric ganglion cells. These are basically nerve cells, and they're absolutely crucial for controlling peristalsis, that rhythmic muscle contraction that pushes food and waste through the gut.
Like waves moving things along.
Exactly like waves.
Yeah.
Without those nerve cells, there's no coordinated movement in the intestines. So it leads to what we call a functional obstruction. Nothing can move forward. So the food, the milk and gas just build up, accumulate rapidly, especially in the large intestine. And that causes the severe colic, that intense pain.
And the distension.
Right. And as the intestine keeps stretching and distending, the tissue can get damaged, lose blood supply. It can even rupture.
Oh, no.
Yeah. If it ruptures, that leads to peritonitis, a massive infection in the abdomen, and very rapid death. Plus, even without rupture, toxic waste products build up in the blood because the gut isn't working.
So how long? How long do they typically survive?
Tragically, not long. Most foals either die or, more commonly, are humanely euthanized within about 2 to 3 days. Sometimes they might last up to 4 days, maybe 96 hours, but the pain is intractable and the complications are just too severe. Euthanasia is really the kindest option.
That's just awful. So we see the devastating symptoms, this heartbreaking outcome, but all of it, all this suffering, it all traces back to one single root cause, doesn't it?
It does. It's all genetics.
So genetics. Okay, let's unpack that.
Right. So lethal white foal syndrome, it's inherited as an autosomal recessive trait.
Meaning?
Meaning a foal has to inherit 2 copies of the mutated gene to actually be affected by the syndrome. One copy has to come from the mother and one from the father.
Okay, 2 copies. And what's the specific gene? You mentioned it links coat color and the gut.
Yes, this is the fascinating part. The specific culprit is a mutation in a gene called the endothelin receptor B gene, usually abbreviated as EDNRB.
EDNRB.
This single gene is incredibly important during embryonic development. It guides how certain cells develop and where they migrate, where they move to in the developing embryo. And critically, this includes melanocytes.
Those are the pigment cells, right? For color.
Exactly. Responsible for pigment production. Issues here contribute to that all-white coat. But even more critically, EDNRB is vital for the development and migration of those enteric ganglion cells.
The nerve cells in the gut we were just talking about.
The very same ones. So this one gene mutation disrupts both pigment cell development and gut nerve development. That's the link.
Wow. That's incredible how one gene can do that. So this brings us to the idea of carriers, right? That seems really important for breeders. Why is understanding carrier status so vital?
It is absolutely crucial. So a horse that carries only 1 copy of this mutated EDNRB gene, we call them heterozygous, and designate them NO.
NO for one normal, one overo or mutated copy.
Precisely. These NO horses are typically perfectly healthy themselves. They don't get sick. In fact, they often show that frame overo pattern, that white spotting pattern that many breeders find desirable.
So they look good, they're healthy, but they carry the gene.
Exactly. They don't develop the syndrome, but here's the key. They can pass that mutated gene, the O allele, to their offspring. On average, 50% of their foals will inherit it.
Okay. And this isn't just in paint horses, right? You mentioned other breeds?
Correct. While it's most famously associated with American paint horses because the frame overo pattern is common there, this mutation isn't exclusive to them. It's also been found in American quarter horses, in thoroughbreds.
Thoroughbreds, really?
Yes, particularly those with over no lines in their pedigree, maybe further back. Also found in American miniature horses and even half Arabians. Basically any breed where overo bloodlines have been introduced.
So you can't just assume based on the breed name alone.
You can't. You have to consider the lineage, the pedigree, especially if there's any history of overo patterns, even if the horse itself looks solid-colored. That really underscores why knowing the carrier status through testing is so important across the board.
Right. So let's say a foal is born, it's white, it starts showing these colic signs. How do vets definitively diagnose LWFS? And I guess, why is getting that diagnosis quickly so important in these cases?
Yeah, well, the diagnosis usually starts with strong clinical suspicion based on the signs we've discussed. But the definitive confirmation comes from genetic testing. So clinically, if you have a foal from one of those predisposed breeds, paint, quarter horse, thoroughbred, mini, half Arabian, and has that classic all-white look, pink skin, blue eyes.
Especially if the parents have overo pattern.
Exactly, especially if one or both parents are known overhose. And then that foal develops colic signs within the first 24 hours or so, and importantly, cannot pass meconium. LWFS should be very high on your suspicion list immediately.
Okay, but suspicion isn't enough. You need proof.
Right, and the proof comes from the DNA test. There's a highly accurate test specifically for that EDNRB gene mutation.
How do they do the test? Is it complicated?
No, it's actually quite simple to get a sample. Usually it's done using pooled hair follicles. You need about, say, 15 to 20 hairs. And the key is they must have the roots attached. That's where the DNA is.
Okay, hair roots. Or blood.
Or a blood sample works too. Either one can be sent to a veterinary genetics lab. And the results are pretty straightforward to interpret. They'll come back as NA, which means normal or clear. The horse has no copies of the mutation.
Safe.
Or it could be NO,
Yeah.
one normal, one overo copy. That means the horse is a carrier, likely has an overo pattern itself, but is healthy.
The carriers we talked about.
Exactly. Or the result could be O, 2 copies of the overo mutation. That means the foal is affected. It has lethal white foal syndrome.
O is the lethal combination.
That's the one. And what's so powerful about this test is, yes, it confirms the diagnosis in a sick foal, which helps make that difficult euthanasia decision. But even more importantly, you can use it before breeding. You can test potential mares and scallions to identify those NO carriers.
Proactive testing.
Exactly. It's widely available now. Places like the UC Davis Veterinary Genetics Lab, many others offer it. It's become quite standard. And just for completeness, if a necropsy, a post-mortem exam were done, the findings would be characteristic: that severely bloated, distended large intestine. And then, looking under a microscope, the pathologist would confirm the absence of those crucial ganglion nerve cells in the tissues of the ileum and colon.
So the physical evidence matches the genetic cause.
Perfectly. It's also really important when a foal is sick like this to differentiate LWFS from other things that cause colic in newborns.
Right, because colic itself is common, isn't it?
It is. You might have a simple meconium impaction, for instance, but usually those foals respond to an enema, and critically, they have a normal coat color.
Okay, different symptoms, different look.
Right. Or you could have neonatal maladjustment syndrome, sometimes called dummy foal syndrome. That's more neurological, and again, normal coat color. Or septicemia, a blood infection, or maybe a rare intestinal blockage like atresia. But LWFS is really unique in having that combination: the all-white coat plus the severe gut nerve issue, the gangliomas.
That combination is the key identifier, along with the genetics.
Mm-hmm.
Okay, so when you're faced with this, with a foal that has OO genetics and these awful symptoms, the question everyone asks is, can we do anything? Is there any treatment?
And the answer, unfortunately, is unequivocally no. There is currently no effective treatment and certainly no cure for lethal white foal syndrome.
Nothing at all.
Nothing that can save them. The core problem, the complete lack of those essential gut nerves, is a fundamental developmental defect. It happened while the foal was forming. You can't surgically fix it. You can't medically manage it in a way that allows for long-term survival or quality of life. The prognosis is just grave. It's invariably fatal.
So euthanasia is the only kind recommendation.
Yes. Humane euthanasia is universally recommended by veterinarians. It's the kindest way to prevent prolonged suffering for these foals. It's a heartbreaking decision, but it's the right one in this situation.
That is truly heartbreaking, such a difficult reality. But it also leads us directly to the most crucial point, doesn't it? Prevention.
Absolutely.
Because if you can't treat it, the only answer is to stop it from happening in the first place. This is the only way to eliminate LWFS.
Exactly right. Prevention is completely achievable through responsible breeding practices. And it all hinges on that genetic testing we talked about.
Testing the parents before they breed.
Yes. The strong recommendation, really the standard now, is that all horses, mares, and stallions intended for breeding should be tested for the EDNRB mutation if they have any history of producing Overo pattern foals, or if they themselves have an Overo pattern, or even if they just belong to one of those breeds known to carry the gene, like paints, quarter horses, minis, etc.
Even if the horse looks solid-colored.
Yes, that's a really important point. Even if a horse looks solid, if it has Overo horses in its pedigree, it could still be a silent NO carrier, so testing is wise.
Okay, so test the potential parents. What's the rule then?
The fundamental rule, the absolute cornerstone of prevention, is simple. Never breed two NO carrier horses together.
Never breed a carrier to a carrier.
Never. Because if you do that mating, NOX-NO, there's a 25% or 1 in 4 chance with every single foaling that the offspring will inherit 2 O copies, BOO, and have lethal white foal syndrome.
A 1 in 4 chance of that tragedy.
Exactly. And, I've worked with breeders in the past. Before this test was common, they would face this repeatedly, losing these beautiful white foals, sometimes year after year, and just not understanding why. The relief this testing brought was immense.
I can only imagine. So what are the safe matings then?
Okay, so the safe matings, the ones that won't produce an affected OO foal, are these. You can breed a carrier, NO, to a clear horse, NN. That cross will never produce a lethal white foal.
Okay, NOXNN is safe. What kind of foals do you get?
From that mating, you have a 50% chance of getting another carrier foal, NO, which might have the desired Overo pattern, and a 50% chance of getting a clear foal, NN.
So you can still get the pattern, but without the risk of LWFS.
Precisely. It allows breeders to continue producing those desirable pattern horses responsibly. And the other completely safe mating, of course, is breeding a clear horse, NN, to another clear horse, NN.
NNXNN.
Right. That will only ever produce clear foals.
Yeah.
No carriers, no affected foals.
So the tools are there, test, and then plan the matings accordingly.
Absolutely. And thankfully, industry standards are helping too. For example, the American Paint Horse Association, APHA, they often require LWFS testing for breeding stallions, especially for their offspring to be registered.
That makes sense. Sort of enforces responsible breeding.
It does. That, combined with ethical breeders being transparent about the carrier status of their horses, really empowers everyone involved, owners, breeders, to make informed choices. And the result is preventing the birth of these foals who would otherwise suffer. It's a huge win for the welfare of these breeds.
This whole deep dive, it really brings us full circle, doesn't it? We started with that image, that captivating picture of a perfect white foal, just pure beauty. But now, understanding the science, we see how something as simple, relatively speaking, as a DNA test can completely prevent such profound, such inevitable suffering. It's amazing. It transforms what used to be this tragic genetic lottery into something entirely manageable, a risk you can just avoid.
It really is remarkable.
It makes you realize just how intricate life is, how one tiny change in the genetic code, something totally invisible, can determine such a different, and in this case, tragic, fate.
Yeah. And, you know, this whole discussion, it kind of raises a bigger question for all of us to think about, doesn't it?
Like what?
Well, just the broader implications of genetic screening in general. We see it here in animal breeding, preventing suffering in horses, but think about its impact everywhere. Agriculture, human medicine.
Right. The ethical dimensions.
Exactly. How does this growing power, this scientific understanding of genetics, how does it shape our ethical decisions? How can we use it to improve well-being, not just for animals, but maybe for ourselves too? What we've talked about today with LWFS, it really shows that knowledge isn't just abstract power. It comes with a real responsibility.
Especially when that knowledge gives you the ability to prevent suffering.
Precisely. It's a responsibility to use that knowledge wisely, ethically, and compassionately.